and I just appreciate y'all helping me out with this event. So I'm going to turn this over to Michelle Rogers, and I'll wrap up at the end.
Hi, everyone. My name is Michelle Rogers, and I was invited by Down Home, North Carolina, to be a part of this overdose prevention town hall because the Down Home members know that I've suffered the ultimate loss due to overdose. After losing our sons, my friend Lisa Falmo and I started the SHARE Project, which is an organization striving to eliminate stigma and which offers support groups to those who have lost a loved one to overdose, as well as anyone who has a loved one struggling with substance use. In addition to the SHARE Project, 4 other local organizations are partnering with Down Home to put on this town hall. Western North Carolina Homelessness Coalition is working to end homelessness for all people living in Western North Carolina. Rez Hope is a recovery organization on the Qualla boundary founded by Caleb McCoy Jr. North Carolina Harm Reduction Coalition is a statewide organization providing harm reduction services in every sense of the word, with a very strong presence in Haywood County. Project Closet Door is an organization focused on bringing LGBTQ plus community closer together here in Western North Carolina. Down Home is in the process of collecting information from the community to assess needs related to overdose prevention. And while that assessment is not quite ready to reveal, the preliminary findings are showing that folks aren't able to access treatment, which is consistent with existing data. In the meantime, we want to find out where our candidates in some very important local races stand on the issue of overdose and overdose prevention. From House District 118 race, we have Alan Jones. His opponent, Mark Pless, did not respond to the invitation. From the House District 119 race, we have Joe Samqueen. His opponent, Mike Clampett, also did not respond to the invitation. From the 30th judicial race, we have Justin Greene. His opponent, Caleb Wingate, declined the invitation. Co-moderating our town hall this evening are Jeremiah James and Dr. Bela Ostrak. Jeremiah is a harm reductionist, a drug use expert, and an overdose prevention specialist. He was one of the first people to provide community-based syringe access services to folks in Haywood County. Dr. Ostrak is an applied medical anthropologist for the Department of Research with UNC Health Services at Mayhack. For the last 3 years, Dr. Ostrak has been collaborating with community-based harm reduction organizations in Western North Carolina on projects in Haywood, Madison, Clay, Cherokee, and Graham counties. I will now turn the town hall over to our moderators, who will ask questions of our candidates that were decided upon by Down Home members. Thank you.
Good afternoon, everybody, and thank you for being here tonight. I'd like to start with Mr. Alan Jones, if you wouldn't mind to introduce yourself and share any proposals that you have for ending overdose in Jackson and Haywood counties.
Okay. Well, Jeremiah, thank you for having me tonight. I'm Alan Jones. I'm actually running for Haywood, Madison, and Yancey counties in the District 118 in the House of Representatives. And I'm honored to be here with you to try to learn more, to try to get an understanding of exactly what's out there. Because look, guys, I mean, unless your family has truly entwined and been involved in this, you know, we've got to be more open-minded to it. It's touched my family, but not my core children. It's been some relatives that are close to my family, and with a cousin and an uncle, which we tried to assist, but it's not the same as if it's my children trying to do this. So I'm sorry to say I don't have like a proposal to tell you. I think my number one here tonight is to listen, to understand, because, you know, in an opinion that I have is no one goes out here and decides that they want to become addicted to anything. I feel that that there are people who have, you can be addicted, and please don't take this as being a downgrade, but people can be addicted to work, to games, to things. Can be alcohol, it can be drugs, it can be many things in their lives. Relationships at times can be considered addictive. But so I'm not trying to downplay the topic that we're talking, but I am trying to be more open-minded and learn from you guys, and just, so I apologize. I wasn't prepared to give you a proposal at all, but I do want to learn and listen. So Jeremiah, thank you for having me on tonight.
Thank you, Mr. Jones. Mr. Queen, if you would introduce yourself and any proposals that you have to end the overdose in Jackson and Haywood counties.
Okay, I think I'm unmuted. Thank you. I'm at my kitchen table, safe and sound, and I know we're zooming around, being safe and sound wherever you are. Again, I want to thank you. I want to thank Jeremiah. I want to thank Jesse Lee. I want to thank Down Home Friends for putting on this very important town hall on a very important subject. And what I want to say with Alan Jones, one of the most important things for access to treatment is to expand Medicaid now in North Carolina. It's $4 billion of health care across North Carolina, and it's $30 million of health care in my district of Haywood, Jackson, and Swain, and it's $30 million in Alan Jones's district in East Haywood, Madison, and Yancey. I mean, these are the resources. Whenever I talk with Greg Christopher, sheriff here in Haywood County, he says, what I need is healthcare resources. I have nothing to do but lock them up. Locking them up does not help them. So they just, they have a problem, and they just keep, without assistance, eventually they'll get to an overdose. And Greg says, we've lost last year 26 of our Haywood County citizens. Expanding Medicaid in Ohio, Cleveland, Ohio, a hotbed of the opioid crisis. They cut the opioid deaths in half the first year. That would be 13 if it was this year. We would have saved if we had just in Haywood County, and Western North Carolina is the same. There's hundreds of serious overdoses in Western North Carolina every year, and many of them cost the citizens their lives. So I am very much, I can tell you a little bit about my history. It's not the first time I've been involved in this. Back in 2006, 5 and 6, I worked really hard to get pseudoamphetamines behind the counter because they were cooking up meth everywhere, and we had a big fight with the Retail Merchants Association to take it off the counter because they were buying it and cooking it and putting it out. I worked very hard with Walter Dalton and Representative Ray Rapp, but we finally got that behind the counter. That was the first thing I fought with. I have worked bipartisanly with Jim Davis on the SAVE Act and some other things that really help get prescription drugs under better control, better oversight, stopping the overprescribing and keeping it coordinated from physician to physician, and a lot of good things. But nothing will help like expanding Medicaid, because that improves access. In Haywood, Jackson, and Swain, my district, it's 8,000 citizens whose health care we've paid for, and our Republican General Assembly is denying it. So this is the year. We've been through a pandemic. We couldn't get them to expand Medicaid. We're in a job crisis. We need healthcare workers. That 30 million in Haywood, Jackson, and Swain is not only healthcare for 8,000 of our neighbors who need it, many of them with opioid issues and in this crisis, but it's 400 good healthcare jobs in this Haywood, Jackson, and Swain community, and we need the healthcare workers. So it's access, it's quality of care, and it's just common sense and common decency. So the big thing that I will push forward is Medicaid expansion, and that is the #1 issue on the ballot, in my opinion, this year. I'll say a few other things. I have been a recovery advocate. I have worked with the communities rallying for recovery. I have been in Swain County with the Cherokee and Haywood County at Lake Junaluska. I have worked in my church in faith-based groups to give respect and understanding and advocate for awareness of this critical issue. I mean, when you think of Haywood County losing 26 citizens in 1 year, I mean, we're in the worst pandemic since, I don't know, maybe since ever in America, but we haven't reached 26 deaths in Haywood County yet. So it's with us, and healthcare matters. Healthcare matters for the COVID-19. It matters for people everywhere, but it certainly matters for the folks that have addiction, because they need mental health, they need counseling, they need recovery services, because very few people can do it without support.
Mr. Queen,
critical.
Mr. Queen, your time is actually up. We need to move on to Justin Greene, please. Thank you so much. Mr. Greene, you're up. Thank you.
Sorry to
Thanks
cut
so
you
much,
off there, there, Sam.
Thank you.
I hope you guys can hear me. I'm a few days into a 14-day COVID quarantine, and I'm having to sit outside to stay away from my family. And so if the wind kicks up or something, then just let me know and I'll try to talk a little louder. I'm Justin Greene. I'm running for district court judge. I have been practicing law for 15 years in our judicial district, which consists of the 7 most western counties in North Carolina. That's Haywood County all the way out to Cherokee County in the far western area. I suppose, coming from a perspective of somebody who's in the court system and seeing this from, I guess, more of a judicial perspective, when you're asking for solutions, for me, I think what I do is I would have to go back and defer to ideas that I've seen work in, like, drug courts in treatment type court capacity. I know most of the change is going to have to come from a legislative perspective, like real laws passed. Like, there are certain things that have been going on in some Western states, like Good Samaritan laws, where if you report an overdose, you might get some immunity from a low-level drug prosecution, or something like, situations where if you disclose that you have a needle in your pocket, then they won't, you won't get prosecuted for a drug paraphernalia charge if you've made that disclosure up front, to try to avoid some harm issues associated with these drug cases. Those are solutions better left to the legislature, not the judiciary. So what that leaves us with is to be understanding. And I know that Mr. Queen a minute ago mentioned that he was getting a big push to have people, they lock them up, put people in jail. Well, that's not always the right decision to make in cases like this. That's a tool in the toolbox, but that's just one tool. And there's a saying, if all you have is a hammer, then everything looks like a nail. We got to get away from that kind of mentality and get to a mentality where there are other solutions to this, so that instead of trying to put a Band-Aid on a broken bone, we actually set the bone. And my ideas at this point would be, as far as if you're sentencing to defendant to like a probationary type judgment, there are things that you could do as far as mandating treatment, mandating returns on the probationary judgment, and trying to be a little more understanding that these kind of things are going to happen. A lot of the district court deals with families, and they deal with issues surrounding if kids are removed from DSS or custodial issues, and in all of the DSS cases that I've handled, I'm a DSS attorney. I've been doing DSS work now for more than 10 years. In all the DSS cases that I've handled, almost all of them are there's some issue of substance abuse, whether it's alcohol, whether it's opiates, whether it's even, something else, methamphetamine. There's always some type of component of that, almost always some type of component of that. And what we do is we recommend treatment, and we try to walk parents through in case plans that would address their underlying issues so they can get their children back. Well, in the past 4 or 5 years, there's been a movement toward understanding that part of recovery is relapse. And we have to, any judge that gets this job, whether it's me or whether it's my opponent, Mr. Wingate, we have to understand that recovery is going to have relapses involved. And we can't be too heavy-handed when we're making decisions about folks that are just trying to get themselves better, and make sure that we don't derail the train when the train is on the tracks just because it hits an obstacle every now and then. And so my solution would be, much like Mr. Jones said, to listen and to learn. And then from there, try to make sound decisions based on what my view of the evidence is and what the view of how hard these people are trying, how hard the people that come into court are wanting to change, and how best we can see to make like some real lasting change with folks. And that's not just throwing the book at every soul that comes through the door. That's taking some time and really hearing what's happening and hearing the issues and making decisions based on that.
Thank you, Mr. Greene. That actually, perfect timing. As we're at the 4-minute mark, thank you. We're going to move into our questions next. Thank you.
Thank you all very much. Thank you, Carrie and Michelle and Lisa and everybody else who's organized this. So this next part is going to be more of the panel. We have 3 questions, although there's a little bit of trick. One of them is a 2-part question. And just want to say up front, you have 2 minutes per question for each of you. So we'll get you, those who do not go first get to think a minute. So we may want to think about switching around the order so Alan doesn't have to go first every time. But the first question, and some of you touched on this a little bit already, but the first question is, what are the greatest contributing factors to overdose deaths? And maybe we'll go backwards this time and have Justin go first.
I've heard various things about the greatest contributing factors to overdose deaths. I've heard where it's been, polyuse, multiple substances being used at one time, that's a big factor as far as overdose deaths are concerned. And so, maybe there's an education component there where, you're trying to educate people to use drugs a little smarter, because we know it's going to happen. We know people are going to use substances. And when we address substance use, we can't just say, stop it, don't do it, because that doesn't work. We have to be understanding with the needs of the folks that are trying to recover. Another big component about that I understand is non-access to Narcan. We've got to make sure that there's enough Narcan out there to go around for folks who encounter folks in an opioid-induced crisis that can bring them out of it. And then apart from that, I've heard issues about folks, if folks are using alone and nobody knows where they're using or what they're using or how they're using it, then you've got potential somebody to overdose without anybody knowing about it or know what's going on. And so maybe there's an educational component to that as well, to make sure you have somebody that can check on you or somebody in your life. Now, not everybody's going to have that, but as best we can, we've got to come up with some solutions for that. And also, I've heard that there's just an issue of underreporting overdoses. And if you've got a group of people together and somebody in that group is overdosed, there's going to be a reluctance to call, EMT or to call law enforcement to assist with the overdose, because nobody wants to get in trouble based on one person dying. And now you've got laws that are passed that require that contemplate somebody getting charged with a murder if there's an overdose due to some drugs that's been sold to them. And that's an issue. I mean, because if we deter people from calling for help, then we've created a situation where people are more likely not to get the help that they need.
Thank you, Mr. Greene. That's your time.
So let's keep going in reverse order and have Joe go next. Same question. What do you think are the greatest contributing factors to overdose deaths? And feel free for everybody to have this be kind of specific to what you think are the biggest factors for your district, for your area.
Good, thank you. I will, let me plug in my phone. It's just gave me a message that I need to plug it in. Thank you. What I will say is I will add to, you know, I can't say that I know the greatest contributing factors. I do know there is multiple factors, and I guess it's different for every individual is what I would suspect. But there are certain things like determinants of health that we're trying to bring to North Carolina. Do you have housing? Are you a victim of abuse? Anything like that? ACEs, I think, lead up to folks self-medicating for mental health issues. Lack of health care, as I said, get health access to treatment is absolutely essential. So lack of health care, you know, denying these 8,000 in my district health care, this is mental health. People need mental health if they have an addiction problem. They need services, counseling, and otherwise. Everybody needs a prescription that suits their situation. We need to be preventative in every way as we think as a community together. How do we resolve this? I've been on several community task forces. It's not simple how you prevent addiction, but we can. We need to, we've been working and we need to do more, and we need to be, and we've learned that over-prescribing opioids gets regular, sensible, ordinary people addicted, and then they get into real trouble and often lose their lives. Really, it's like if any of you have had family members, I've had a brother-in-law who was addicted, and it is a sad sight to see. And even when it's intimate and close, it takes a lot of support, family support, loved ones, and the medical community. So we've got to get the medical and community support around these people. Education is part of that. Community awareness is part of that, as we build a community that is understanding and helpful. So there's a lot of things that go into it, and I certainly think the courts are, and I really appreciate Justin Greene's comments on drug courts and otherwise. So thank you.
Thank you, Mr. Queen. That's time.
Thanks so much. And Alan, your turn.
You know, whenever we look at this, you know, what is the number one piece for the overdose? I think a lot of it goes back to lack of health care. And, you know, when we talked before about the expansion of Medicaid, when you look at the studies, states that expand Medicaid reduce the number of overdoses when those things happen. And so, you know, I feel, and I'm not here to just belabor comments because we said let's have one, and I think that Justin and Joe have hit a lot of the topics, but expanding Medicaid is a number one. And I think we've got to change the way that we talk about this as well. As far as society, you know, the two individuals I referenced earlier that I know that have had some issues, everyone wants to try to act like they're outcasts, but all of a sudden they want to help. And I think that we need to try to help people and try to understand, you know, as we went away from the pills into heroin, and then the fentanyl comes into play. So I think that if we have access to health care and change the way in which we utilize people, instead of treating everybody as a criminal and throwing them in jail, and try to truly look at the mental health side. I mean, in Western North Carolina, we don't have a mental health facility. We're having to go down to the eastern part of the state just to try to do those things. So, but I do feel that whenever people get in those situations, it's not just a one size fits all, that we've got to give people opportunity and resources to be successful and have hope that they can be there. So.
Thank you so much. I'll turn it over to Jeremiah. You get a little bit of a second chance at the earlier question, but in an expanded form.
Thank you, Dr. Ostrich. My question is actually a two-part question. It is How do you propose to reduce overdose deaths? And do you agree that reducing stigma towards people who use drugs is part of that? And we'll switch up the order again and go with Mr. Queen first.
Jeremiah, do you want me to go?
Yes, sir. You can go right ahead.
So give me the second one. I got the first one, reduce overdose.
Yeah. Do you agree that reducing stigma towards people who use drugs is part of that?
Well, I'll answer that one first. And I do agree that is, whenever we do that, whenever we quit trying to and I hate to use the word lay blame and try to, I mean, we need to encourage people and to be resources and quit using terms and the way that we talk about this is I think critical to the process. And I'll be honest, I read the information that was provided to me, and I think we need to use words like impact instead of using the words that were out there about, you know, crisis and pandemic and epidemic. And let's talk about, let's change how we do that. And if we start now and small steps that just to give people feel like that they're not, and I really, and I'm not trying to say that. Some people try to say that people that do drugs are trash. They're not trash. They're human beings. And we've got to give them opportunities. And if we change how we talk about them and we talk about the impact of what's going on to families, the impact that's going on in the overdoses, impact when it comes to the drugs in general, instead of having labels. So just to answer your question, Jeremiah, I do think that if we change that reducing the stigma, that it does change the paradigm that's out there and the framing of how folks look at that issue.
Thank you for that answer, Mr. Jones. Let me see. Mr. Greene, would you like to go next?
Sure. I think to start with, you've got to, like you said, you've got to treat people like human beings, and you've got to destigmatize the fact that people are going through trouble, and that sometimes, you know, just because somebody's using drugs, that doesn't make them a bad person. It's hard. My understanding of the harm reduction movement, it's a social justice issue, just like anything else. Any other kind of movement, like and one thing that comes out of that, it being a social justice issue, is that there's a movement toward defining better rights for people who are going through those troubles, like at least more available avenues to secure their rights. And just because somebody's using drugs, that doesn't mean that they don't have rights. Just because they're a substance addict, that doesn't mean they don't have rights. We have to do things we have to, at least in the court, from a court perspective, we have to make sure that those folks' rights are just as intact as anybody else that comes into the courtroom. And it's a strange thing talking about this from the judicial perspective as opposed to from like the legislative perspective, because I can't get up here and say expand Medicaid. Because, you know, expand Medicaid, fantastic, that's great. But somebody else down the line's got to do that, which leaves district court judges and lawyers on the front lines. I can tell you this, that I have in my life represented more than 3 or 4 people that have died from overdoses. And I believe that had somebody stepped in sooner, and rather than just tried to act punitively toward those folks, and tried to do something toward, I don't know, in a humanitarian way, maybe just to reach out a hand and say, hey, listen, we know you're struggling. We're trying to help you here. That may have been the better way to go. I mean, I know hindsight now is 2020, and we don't know what would have happened. But I got to think that if we keep doing the same thing that we've been doing for the past 30 years, that we're going to get the same results as that we've gotten for the past 30 years. And we've got to be a little more creative with how we address defendants that come into court for substance issues, whether it's paraphernalia crime, whether it's possession crimes, and be a little more creative with the sentences and maybe a little bit more lenient with how things go.
Thank you.
Thank you.
Mr. Jones, or I'm sorry, Mr. Queen, if you would
Thank
like to
you.
finish up.
I finally got my thing unmuted. I apologize. But I appreciate that. I'm learning from everybody's responses, which I think are really thoughtful. I I'm pleased to be part of this town hall. First, on the basis of the numbers, when you can reduce the overdose deaths in Dayton, Ohio by half by expanding Medicaid the very first year. Virginia, in 6 months, cut their emergency room overdose situations by 30% in 6 months after expanding Medicaid. Healthcare access really helps. So that I can tell you, that's the most. Some of these other things are good. We're learning not to overprescribe. We're learning to protect those prescription processes and contain them. We're warning the public about these problems. All of those are very good steps, but there's no step that'll save more lives quicker than expanding Medicaid and giving healthcare access to folks. I also will echo what Justin has said about it is a very good thing to have more understanding at the court level. Drug courts, there's a veterans court in Asheville, and most of the veterans' problems come from substance abuse, and many of them have dealt with overdoses. So those are two good progressive court initiatives. We need to get out of the baseball metaphors like 3 strikes and you're out, because 3 strikes and you're out, because that has been used to incarcerate folks and not get them help. We need to get them help, realize and recognize that, as Justin said, that relapse is absolutely part of recovery. It's not a straight line. These are serious mental health issues that need lots of help and lots of understanding. So there's a lot to be done in the criminal justice system, including training law enforcement and along the way, the court systems along the way. Really, we're going to have to educate some legislators, believe it or not, to get this going. But let's expand Medicaid and let's move forward together.
Time, thank you.
Thank you, gentlemen, for your insightful answers. I appreciate that. I will turn it back over to Dr. Ostrick.
Thank you all, and thank you, Jeremiah. I was just thinking, we are not going to make prime time with everybody agreeing with each other so much. This is an unusual town hall where none of you are contradicting each other or arguing. And I was going to say, Jeremiah and I also are armed with pages and pages of citations for evidence-based research in case we needed to rebut or correct anything you said, and we've not had to do that yet. So.
Well, all our opponents decided not to come in today.
Correct. Yes, that made it easy.
Harm reduction is a partisan issue. Who the hell knew that?
Yeah. Well said. Well, it's going to leave more time for Q&A and discussion, so that's not bad. So our final question for everyone is, again, a variation a little bit on what we've already spoken about, but if you would like to get more specific and think particularly about the folks that you would be representing and folks that you are potentially sentencing, and think real specific about how you would protect people who use drugs against overdose. So if there were somebody that was directly your constituent or standing in front of you in a courtroom, what do you think you could do to help protect a person who's using drugs against overdose? And we will just go in random order, and I will say Justin first because that's who I'm looking at right now.
Let me kind of, can you hear me? Am I coming through okay? Okay. One of the things that I guess I would advise folks to do who are in my courtroom for that, I would talk about the needs of my client. If I was coming from the legal perspective, if I'm their attorney, and we're about to go in and we're about to address maybe a crime that they've been charged with, something like that, I think I would start with them because I think any solution's got to be tailored to the individual. And you don't know what somebody's been through until they tell you what they've been through. I can't look at you or look at Alan or look at Jesse Lee or Joe Sam and walk in y'all's shoes, and nor should I be able to. What we have to do is maybe have a little bit better dialogue. The attorneys that come into court need to have some conversations with the folks that they're representing to understand from them what their needs are, what's worked for them in the past, and then decide what's worked what may work best in the future. And I think I would start with that. I saw a second ago one of the comments in the chat, they were asking about stigma, and if I had a thought on that while Joe Sam was talking, and if I could just kind of jump on that real fast. you know, I almost see like stigmatization of a drug user is almost a due process issue to me. My kid one time asked me how I could represent somebody that was charged with a crime or that was guilty of a crime. And I explained to him, so, you know, if that was if that was you and you were charged with something, wouldn't you want somebody there to speak up and say, hey, I didn't do this, or, you know, maybe I need help with this. And I think that's the perspective that we come at this with too, is a perspective of a due process standpoint. I think we look at it like, you know, how can we help, and what steps are we going to take to help, and how do those steps fit within the court system? And I think maybe that's where I come in, to try to weigh these things on a case-by-case basis, tailored to the individual, and see what we can come up with.
Great, thanks.
Sorry, Carrie, I cut you off. All right, Joe Sam, let's have you go next.
Thank you. This is sort of what you do personally when somebody comes to see you, or you get engaged with them, or get engaged with their family. First of all, I would reinforce what Alan Jones started with. We need to listen, because none of us are walking in the shoes of the addicted. It's serious. It's serious for them. It's serious for their families and loved ones. So listen first, so you get informed. Be respectful. Be respectful of everybody. I love the due process point that Justin brings forth. Don't condemn them. You know, listen and see if you can be a part of the solution, and see if services can be part of the solutions. See if your relationship can be part of the solution. So, you know, listen and advocate for this community in the public. I mean, I think we do have bully pulpits as legislators, and we need to advocate that, you know, 3 strikes and you're out, and, you know, throw them in under the jail is not the way we need to move forward if we want to be authentic and to our citizens and our neighbors. If we want to care for them and their families and their situations, we need to be part of a solution. And again, it's a societal thing, overdosing and drug uses and these issues. But then I would also just fundamentally, I fought a decade to get Narcan available in North Carolina. And it does help. Get your Narcan, family members, get your Narcan. If you are using, have it. If your friends are, that may save your life, may give you a second chance, may give you a chance to wake up and move into recovery. So don't cut yourself short. So, you know, it's difficult and it's painful, but be prepared where you can, and let's work together. Let's realize this is our problem. It's not just the addicted. Most of the addicted didn't want to be addicted. They got trapped.
Thank you. It's time.
Thanks so much. And last but not least, Alan, how would you support somebody in your district who's using drugs, and how would you protect them from overdose?
Well, you know, I think whenever we talk about how we can support them, I think that we need to be looking to see, you know, what's the underlying issue? What's going on here? Is it affordable housing? Is it the pieces as far as work? Do they have jobs that pay living wages? Are they have access to health care? I mean, when we look at those things, to try to truly dig down deep to see what's going on with folks. As a union representative, I've had my fair share of dealing with folks who have, you know, either been injured on the job and ended up taking, well, this is back whenever the opioid crisis had first started out. You know, now it's moved on to heroin and other things, but they would get prescribed a drug for their back pain. The next thing you know, they're addicted. Or you see a guy who shows up to work and you're around him every day and everything's good, and then all of a sudden you start seeing a change in him. So you're trying to talk to him to see what's going on. I had a very near and dear friend who was working with us, and he ended up addicted to painkillers and ended up progressing on to worse drugs, and then, you know, and eventually lost his life due to all those things. But I just wish that I could have given him hope, so that to give him resources to be able to change his way. And it's not something you can force on somebody. I think you have to try to be compassionate, caring. And people, tried to give me a little bit of grief over some of these positions that I've taken when it comes to these different programs. I don't feel they're enabling people. I feel they're giving people hope and the ability to change their lives. Because if you don't feel that there's any way possible that your life can change, why change? And if you give people hope and you give them the support group that they need so that they have someone to talk to, it can be just, I really feel that that's what we got to do. As Joe Sam talked about, as we said earlier, it's listening and just being there for people, and then provide them with the resources they need so that they can have the productive pieces to be able to move forward. So I really do think that we all can come together and do this. So.
Great, perfect timing. Thank you.
Thank you all very much.
And now we're going to take some questions from the audience. Lisa Falbo, a friend of mine who's with the SHARE Project and on this panel, has been looking at the questions that have come up in the chat, and she's going to ask those. She's going to pick which ones we use, because we've actually ended up with about 5 extra minutes. So
Okay.
I think it probably at least one for everybody. Maybe not 2, Lisa. I'll let you.
Okay. Well, we
Okay.
got 2. We do have 2 very good questions. So I will go ahead and I'll start with the first one, and we'll just kind of see where we go with that. Somebody asked what the possibility was of the death by distribution law being overturned. And I'll let you guys choose who to answer that first. Maybe Justin. He hasn't spoken in a few minutes.
Hear me over the wind with it. I think that's probably there's a pretty low chance of that, because politically, you're talking about a group of folks that don't have a big lobby behind them. The folks that are most in need of that are the folks that are being charged with it. And the issue is that I think the general public as a whole is kind of likes the punitive nature of that. They want to see somebody pay for a death. There's like a real there's a real eye for an eye quality to it that sort of appeals to our political landscape right now, and that's unfortunate. But I don't see it happening unless there's somebody overturns that at an appellate court level. I think that thing may be here to stay until there's some big changes in the General Assembly.
All right. Let's turn it over to Joe Sam Queen, maybe.
Yes. Justin has laid out sort of the tone. All 3 of our opponents are not on this call. So there is one side that is very, very strong on this punitive components of these laws. I do think with a new majority, which I'm working very hard for, and I hope Alan Jones will be part of, if we can get a new majority, we can expand Medicaid and we can reconsider this. We can certainly improve it if we don't completely change it, but it makes a lot of sense. The debate was serious in it. It got improved during the debate there, but I think it can do. It can have another round with another majority, because we're learning to not that the punitive approach does not work on this issue. Understanding and appreciating it's a much more complicated problem. Plus, people are beginning to accept the idea that when you're addicted, it's not your character. You have a medical condition and it's really seized you, and you really need help to conquer it. And hopefully we can build some understanding and change that, I think, to the better.
All right. I believe Alan Jones is the last one to answer.
Yeah, I think when we talk about the makeup of the law and it actually being overturned. I think that as far as changing the law, people, I think the other two have outlined how a lot of people in the community do not understand. I think it's going to be an educational thing first. We've got to do that. We've got to educate people on truly what that is and how that works, because, you know, there are folks, you know, drugs are bad, and people who do drugs are bad people, as we talked about with the stigma. And so we've got to change all those things, and it is a process, and it will take time. But to straightly be able to say, oh, it's going to get overturned immediately, I don't see that happening, just because of where we have a lot of society. But I think if we work together in this process to try to understand more of educating others of what's out there. And, you know, I think there are variations. I feel in North Carolina, the law has been modified where if the person is a friend with them and not a trafficker or a dealer, I think is kind of the law. But Justin will be the guy to talk about the law and not me, and I'm not here to put him on that. But not understanding, you know, the complete makeup. I think the first thing we got to do is to get the society to change their thoughts on it so that we can advocate for that.
Okay, we do have another question that came in. Do we have time for that, everybody?
We've got about a minute. Yes.
Okay.
Or excuse me.
Boy.
Oh,
We got
plenty of time.
Okay, excellent. So this is one that came into the Q&A. How do you plan to reach across to more conservative-minded politicians and constituents to help advocate for those suffering from substance use? And maybe we will start, oh, mercy.
Well,
Let's go with Justin.
We'll just go back to Alan.
Okay, let's go back down. There we go.
Nothing to me. I'll go first. Look, we've got to get people to have real life stories. Okay, that's what, you know. I've had the opportunity to do a lot of things for working people. Okay, and talk to legislators about working people's issues. And I truly feel that the way to a person that, because we're all humans, they may not act like they're human in their tone and how they treat people, but life stories, when you can relate people to what's going on. You know, my opponent talked about, oh, he doesn't drink because he knows he'll be addicted. Come on. Look, I respect that, not doing those things. But I think that we have to look at the human side of this and have human stories and bring those to people. And if that doesn't work, then we have to try something different. But I truly believe the first thing is to have the conversation so that you can bring real life stories that people have. That's what makes change, is when we all come together with our stories, and that's what then we then pressure and put that on legislators to say, look, things are going to change because this is real life stuff. This is not make-believe hidden behind a building somewhere and it's not reality. This is real stuff, and we've got to, as a society, we have to deal with it.
We'll take it to Justin next for that to answer.
Yeah, so my thinking is this. Like, one of the biggest questions that I've gotten, well, two biggest questions that I've gotten as I've been around campaigning are, number one, what are you going to do about people who come back into the court over and over? What are you going to do about recidivism? And two, are you going to be tough on crime? And now, across the board, those are two ideas that people have came to me with their criticism of, like, well, we're not tough enough on people, and it's the same people coming into court over and over again. What are you going to do? And I think that's when you bridge this gap. When that comes up, you say, listen, right now we have mandatory minimums and mandatory maximums set by the legislature in the district court. District court is not reinventing the wheel with regard to sentencing. And we are district court judges are allowed to sentence only in certain ways. But then you can explain to them and say, hey, listen, since we've been trying this, and this for so many years, how about we move into something new? How about we try to make use of some of these strategies that you've seen in drug court or DWI court or veterans court, where you try treating a problem rather than just locking the problem away and putting it out of sight, out of mind. And so I think that's, at least from a judicial perspective, how you bridge that gap to the other side. You say that, some concerns are universal among the community, whether it's Democrat, Republican, conservative, liberal, whatever. A lot of people are concerned about, everybody's concerned about their safety, and everybody's concerned about their health. And so you make those connections as available solutions for everybody. And you bring in these same ideas that you've seen in drug court, and you try to accomplish them in the way that's outlined for the district court to do that now. And so we use the tools that are there, even though we don't have those court systems in our district. There's a chance that we can use some of those tools in that toolbox to improve our judgments.
Okay. Can you hear me?
Yes.
Yeah. Yes.
I'll go last on that question, and thank you again for these very good questions all across this town hall. Thank you very much. I've spent, this is my 6th term reaching across the aisle. You do want to be respectful to all your members. They're not necessarily respectful to you, but I try to always dig down deep and be respectful of them and listen to them. But I'll hit on what Justin said, recidivism. What are you going to do about it? What are you going to do about it? What are you going to do about tough on crime? Well, you're going to give these addicts some health care, because substance abuse is a health care problem. And if we actually want to do something about recidivism, we're going to have to get some health care to these folks, some mental health training, some substance abuse training, some resources to give them hope, as Alan said. And then, it's not so much being tough on crime, it's being smart. Let's start being smart on crime. So I'll try to get that across to them. I'll listen to them. Do you not have a brother-in-law that's had this problem? What did you want to do? Throw him under the jail, or did you actually want to help him? So I think now we're in an era right now. I've been very supportive of my law enforcement in this area. And the law enforcement, Greg Christopher, Bill Hollinstead, they have driven me on this project. They have educated me on getting meth behind the bar, getting prescription drugs under control, reaching out and educating folks and being sensitive. So I know we have some good law enforcement. So we don't have to say just law and order or something else. We got to do both. We've got to be smart on crime, and we've got to have good law enforcement that are well trained and thoughtful. We've got to have this conversation, because a lot of it has to do with economic situations and social determinants of who gets into this trouble. It's not entirely that. It's across the board, but the solutions will engage those issues. So I am open-minded to my fellow legislators, because I know we're going to have to work together. But it is my true hope that I will be in the majority and they'll be in the minority, and their minds will open a great deal. I can tell you that.
Lisa, were there any more questions? Is that it? We good?
Yes, there was another one here that's well worth asking, I believe. With minorities having experienced so much injustice in the criminal justice and healthcare systems, how can they feel confident they will receive equal and fair services?
And I would say whoever is the most enthusiastic about answering that one, so you can answer it. We are getting down to the wire as far as time. It looks like maybe Joe Sam, he jumped at the screen.
I'll jump. I'll just say that is a very difficult question, but it's a very important one. How they'll feel comfortable. We've got to get up and lead and realize that race and socioeconomic discrimination is real, and we've got to quit stigmatizing anybody and start really looking at the individual and dealing with their problems. So I really think America is on that threshold. I think politics are ugly, but politics are also pretty poignant at the moment. People want us to deal with the reality and the real situation in America, and I'm open for those conversations. And they're both and conversations. They're not either or conversations. They're both and.
Jump in next. Let me say this: I can't speak for everybody, but I can certainly speak for me. In that, if I have the good fortune to be elected and I'm your next district court judge, then I can promise you that whoever comes into my courtroom, they're going to be treated the same way. They're going to be treated fairly. They're going to be treated with dignity, and they're going to be treated with respect. And that's just a promise I can make and a guarantee. And so,
I appreciate that, Justin. Alan, you want to weigh in?
I will. You know, I mean, I think that whenever we talk about this, we're all human beings. We're all working people, okay? And we all got to be treated equally and fairly. And I mean, I think that's what we strive for to do in society, is to get out there, because, you know, your paycheck doesn't reflect you, you know, if you're, no matter what race or sex you are, okay? We got to bring people up. We've got women that we've left behind in pay and minorities behind. We got to bring people up, and in healthcare and any other thing in society, we got to get people being treated with dignity and respect. And do those things that we need to do for working families. And I think when we do those things, that gives people hope, that gives them opportunity, and that gives them things to strive for, so that they can, you know, be productive and really feel good about themselves. You know, whenever you're able to provide for your family, provide for yourself even, that gives you an empowerment that you can do and move forward with. So I think that's what we should be doing.
And I'm going to close this out here. I want to thank everyone profusely for being on the panel, being in the audience. And I want to follow up with what Joe Sam Queen said about naloxone. And I learned a lot of this stuff from Dr. Ostrak and from Jeremiah. And there's some harm reduction folks that are in the audience that have taught me a lot of what I know here, as well as the participants that I've interacted with working in harm reduction. But he said, carry naloxone. And everyone in North Carolina has a prescription for naloxone. There's a standing order prescription. So you can walk in any pharmacy and get that. Now, if you have good insurance, I recommend you use your insurance to get it. If you cannot afford that, you can get that for free from your local harm reduction folks. And I'm going to we have a harm reduction helpline here in Haywood County, and that for any kind of harm reduction needs. So if anybody needs naloxone, just hit these folks up. And then I'm going to talk real quick about Down Home's relational voter turnout program. So what Down Home does, and especially like the mission during election cycles, is to get people into local office. It's like, y'all seen, we saw the other night how crazy national stuff is. You know, we knew it was crazy, and then we see this dumpster fire in a dumpster fire. What? So we are concerned with local elections and local offices. And we want people whose values align with our own. And in this case of overdose prevention, we need people in office who are going to be aggressive in pursuing evidence-based programs to prevent overdoses. And it's already been mentioned a lot in this town hall, but one big step in that direction would be to expand Medicaid. So we are wholeheartedly supporting candidates who will fight for Medicaid expansion, because we are losing lives and money until that happens. And the way that you can help us get folks into office who want to prevent overdoses is to join our regional voter turnout program. That's a really big phrase that means having conversations with your friends and families about local races, which most of y'all are probably doing anyway. And those conversations that you have with your friends and family about local races and encouraging folks and educating folks, that's over 4 times more effective than talking to strangers, you know, canvassing door to door that we used to do, which we can't do now anyway. But this is a more effective route. So the link to sign up is in the chat box. And then usually in, you know, pre-COVID times, we're at a meeting like this, we would disperse, but we'd all kind of stand around and chit chat about, you know, what was just thrown at us. So we can't do that, but we have a virtual option for that as well. I want to direct folks over to the Facebook pages for Down Home Haywood County and Down Home Jackson County. Where am I? so that we can continue this discussion and like see what we can all come up with as far as solutions for everyone, for the betterment of everyone here in Western North Carolina. Again, I want to say thank you for everyone coming out tonight, and y'all have a great evening, and we'll be in touch.
Thank you, guys.